And this is Andrea with the Disabilities Commission. Wes, are you ready to open the meeting?
Yes, I am.
Okay, great. Then I'm going to read the open meeting law statement. Good evening. The open meeting law requires that I notify the public that this meeting is recorded. Therefore, please be aware that an audio and visual recording of this meeting is being made by Boston City TV, a part of the City of Boston Office of Cable Communications, and is being broadcast on Xfinity Channel 24, RCN Channel 13, and FiOS Channel 962. I'll hand it now to our board chair, Wesley Ireland.
Good evening, everyone. Welcome to the first meeting of the new year, 2023, and Happy New Year, everyone. I'm going to call to order the meeting and open it up now. And we're going to start off with introductions from the board, as well as for myself. I'm Wesley, and I've got two female interpreters with me. I'm a man, and I have two females that are speaking. I am the chair, and I live in the area of North.
I live in the North End.
I live in the North End, and
I'd like to call Olivia, please.
thank you.
Hi, my name is Olivia Richard. I'm a member of the board, and I live in Brighton.
Thank you. Lucia?
Dusay, please. Dusay?
Hello, thank you. Yes, good evening, everybody. Thank you very much as well, Wesley Island, and Happy New Year from me to you all as well. My name is Ducia Lebowski, or Ducia L for short, and I'm the vice chair, and I'm in Boston, specifically in Mission Hill. Thank you.
And now Richard?
Hi, everybody. Good to see you all again. I'm Richard Glevsky. I am also an associate commissioner of the commission, and it's good to see everybody, and I live in Back Bay.
And Carl?
Good evening, everyone. My name is Carl Richardson. I am a deafblind individual that lives in Brighton and also a member of the commission and treasurer as well.
Thank you. Jerry?
Yes, my name is Jerry Boyd. Happy to be here for the meeting. I live in West Roxbury, and I'm proud to serve on the advisory board as well.
Thank you. Zari?
Hi, my name is Zaria Hosseini. I'm the member of the board. My pronouns are she, her, hers, and I live in South Boston.
Thank you. Elizabeth?
Hello, my name is Elizabeth. Excuse me, I have a tickle. My name is Elizabeth Deepflower. I'm a board member and I live in Back Bay.
Thank you. Alice?
Hi, my name is Alice Fisher. I live in the South End, and I'm a member of the board.
Thank you. And I see John He's on the phone?
Juan Carlos?
Oh, sorry.
My name is Juan Carlos Ramirez Tapia, also advisory board member, and I live in Boston South End.
Thank you. And I don't know if Charlie is here at the meeting. Is there anybody else on the on here through telephone service that I can't see? Do we have quorum?
This is Andrea. Yes, we have a quorum.
Great, thank you. I would like to talk about the board meeting minutes from last meeting. Is there anybody that has any questions from the December board meeting minutes?
Before we approve the minutes?
I would like to make a motion that the December minutes be read and
Approved as read, and a second to the motion?
This is Carl, I second.
okay.
Yes, this is Jerry. Just a point of order. Wes, I don't believe that you as the chair can make the motion.
All right, this is Carl, I make the motion.
Oh, and this is Jerry. I'll second it.
Okay. Thank you. Thank you, Jerry, for clarifying that and for making.
All in favor?
Aye.
Say aye.
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 Okay, all in favor, and the motion's passed. Thank you.
Hi, this is Kristen McCosh, the commissioner. I just want to jump in for one moment. I just want to let people know that we have a new board member joining us tonight, Paulette Durrett. So I wanted to throw it to her to introduce herself. And I know she wasn't at the last meeting, so she may not have chosen to vote on the meeting minutes, but I would like to let her introduce herself to the group.
Good evening, everybody. My name is Paulette Durrett. I was at the last meeting, and I haven't been sworn in yet. My date is January 30th, and I come from the Mattapan section of Boston. Thank you.
Sorry about that, Paulette.
Okay.
This is Carl Pollack. Can you tell us a little more about your background?
I'm a retired administrator from Boston College. I worked there 25 years with students with disabilities, physical, medical, and psychological. I'm active in the retirement community with AARP and Mass Senior Action Commission. I'm active in my church, and I'm the proud grandmother of 2 adult children.
Welcome.
Thank you.
Welcome, Paulette.
Thank you, Paulette. Welcome to the commission. Okay. I guess we'll go ahead and start with the presentations from Dr. Lisa.
Izani.
Thank you.
Hi, I'm delighted to be here. I do have a brief slide presentation, and then hopefully we'll have plenty of time for discussion. Oh, you've got my slides up. So does somebody want to run them for me then?
Absolutely. This is Andrea. Just let me know when you want me to advance the slide.
Perfect, Andrea. Okay, let's go with the next slide. Okay, I'm here to report tonight on the results from a national survey that I was privileged to lead of physicians caring for people with disabilities. Next slide. focused on outpatient practices of physicians caring for adult patients. And I'm also a member of the disability community. I've used a wheelchair forever. And a lot of my disabled kind of friends say to me, Lisa, you haven't told me anything new. You've just kind of told us what we already know. But nevertheless, it's often really helpful to have numbers to attach to kind of feelings and experiences that you've had. And so unfortunately, we didn't have enough money to survey all different types of physicians. And so we focused on internal medicine, general internal medicine, family medicine, rheumatology, neurology, ophthalmology, orthopedics, and obstetrics and gynecology. Next slide. Okay, so again, I'm not telling you anything you don't know. The first thing is that the ADA requires people with disability to receive the same quality of care as other people. And this might require reasonable accommodations. Next slide. Okay, but more than a third of doctors report knowing little or nothing about their legal responsibilities under the ADA when caring for patients with disabilities. One of the findings that really threw me was that 71% of doctors do not know the correct approach for determining reasonable accommodations. And so therefore, it's not surprising that almost the same number, 68% of doctors report at least some risk of having an ADA lawsuit. Next slide. Okay, so our survey looked at different types of disability and issues for people with different types of disability. And so these first couple of slides look at people with mobility disability. And only 23% of doctors always or usually use a roll-on or accessible weight scale. A third of them just simply usually or always ask patients their weights, and 40% of them just sometimes ask patients their weights. Next slide. Only about 40% of physicians always or usually use height adjustable exam tables. Those are tables that automatically go up and down for patients to transfer onto. And in fact, only a third of primary care physicians use height adjustable exam tables. And pretty much no physicians ever use a lift device like a Hoyer lift. In fact, 40% of physicians always or usually get help from the person accompanying the patient to transfer them onto the exam table. Next slide. Blind or have significant difficulty with seeing even with glasses or other corrective lenses have told us in the past that they often benefit from large font printed materials or having the room verbally described to them. But 56% of physicians, over half, rarely or never give out printed materials in large font. Only 25% sometimes do that. And again, 50% of physicians rarely or never verbally describe the exam room. Next slide. So some of the worst findings for me were having to do with people who are deaf or have significant difficulty hearing. So 50% of physicians never use a sign language interpreter hired by the practice. And 63% never use video remote sign language interpreters. So basically, they don't provide the best accommodation for people who want sign language interpreters. Instead, 50% of physicians simply always or usually just speak louder and slower to patients who are deaf or hard of hearing. Again, 50% almost just always or usually speak to the patient's companion. And a third always or usually just write notes on paper. Next slide. So we want physicians to be confident that they can provide the same quality of care to people with disabilities as they provide to other people. But only 42% of physicians are very confident that they can provide the same quality of care to their disabled patients as to other patients. Next slide. And when you add up these numbers and you account for weights, that's a statistical speak. But anyway, let me just give you the bottom line number here. And that is that 82% of doctors think that people with significant disability have overall worse quality of life than other people. Again, 82% of doctors think that disabled people have worse quality of life than other people. Next slide. And then finally, only 57% of physicians strongly agree that they would welcome people with disabilities into their practices. Next slide. And we looked at whether physicians feel that people with different types of disability get worse quality of care. And because of time limitations here, I just want to show you the worst finding. Okay, and the worst finding is that 77% of physicians think that people with serious mental illness get worse quality of care than other people. Much lower percents of physicians felt that people with different types of disabilities got worse quality of care. Mental illness is really where physicians feel that patients get the worst quality of care. Next slide. And then finally, we recently published a paper that got a lot of press, including a front page story in the New York Times in mid-October, that came from focus groups that we did before we did the survey, so to help us design the survey. And that kind of provided a lot more kind of richness of detail about how doctors think about people with disabilities. And what was really troubling in those focus groups that I had the privilege of moderating, where I didn't reveal I had a disability, so the physicians were just kind of talking to each other, and just kind of like they would talk without knowing that they had a disabled audience in front of them, is that they were not very flattering about people with disabilities. They think that people with disabilities are too kind of entitled. And one of them talked about people with disabilities wanting to bring their service peacock to their appointments with them. Some physicians talked about ways that they try to get people with disabilities out of their practices. And so it was not a flattering portrayal. Okay, so that's the end of my presentation. So final slide is just a big question mark, I think. Yeah, so it's just a big question mark. So let's get rid of the slides. So at this point, let me just say that if people want to learn more about our survey results, trust me, I'm a researcher. There's a lot out there that I can send to you if you just want to send me an email, and I can send you more details. But at this point, I'd just like it to open the floor to see if people have any comments or questions for me about our survey.
Hi, this is Wes Ireland. I'm the board chair, and I just wanted to say, Doctor, thank you for your presentation. I know the board has a lot of questions, and we can go forward with the questions, but I just wanted to say thank you for being here.
I'm delighted to be here, and basically I feel so strongly about this that whenever anybody invites me to give this presentation, I basically always say yes, because I've been doing this research for 25 years and trying to get people to notice. And it's been a tough haul. And so I'm just glad that finally we have some numbers out there that people can notice and can maybe start helping make policymakers hear us.
Yes, I concur with you. And congratulations
I'm gonna
on
wait.
the Boston Globe notice for your article.
Yes, the Boston Globe article was great. And Wes, I'm going to defer to you to call on people for me to answer their questions, since you're the board chair, and that's your job.
All right. Jerry, go ahead.
Thank you, Wes, and again, I echo Wes's comment, saying thank you, Lisa, for being here today, and forgive me for using the informal, because you and I have
I'm Lisa.
right, you and I have worked together for so many years on so many issues, so I really appreciate you taking us up on our invitation to present today. But my question is not a simple one, but it's a pretty direct one. I know we've done a lot of work, through BCIL. They've done, specific work with Boston Medical Center and before that, Mass General, to bring some of these issues to light and to really work with those facilities and their practices on increasing accessibility for patients with disabilities, and Zari has taken up that work, at Mass General internally. But what else can we do, Lisa, as a board, as a disability community, as a larger community in Greater Boston? What else do you think we can, what are some things that what are some practical things that you think we can do? What are some first steps we can take to illuminate these issues, as you said, to the policymakers and whatnot?
Yeah, well, Jerry, thank you for that question. And it is a really complicated question, because it is true. I mean, Zari is a very strong leader at the Mass General Hospital in terms of trying to make a difference. But this was a national survey, so we don't really know whether Boston or Massachusetts is better than other places. But let me just say, I recently had to go in for a minor procedure, and this is an anecdote, so I know we don't like anecdotes, it's just an N of 1. I couldn't get onto the exam table because it wasn't a height adjustable exam table. And fortunately, my husband was with me, and he had to help me get onto the exam table, and this was at a big Boston teaching hospital. And so we know, again, this is just an N of 1, and probably some people on this call could tell us whether they've had similar experiences, not just about mobility, but also communication accommodations and other accommodations that people need, that we still know that we're not fixed, even for very basic things, like exam tables. An exam table should be such an easy thing, because we know, for example, that practice assistants at physicians' offices have a high rate of occupational injuries. And so we want to make sure to keep everybody around us safe, not just us. And doctors come at different heights. So doctors should have a table set at a height that's ergonomically good for them to do the best exam on us that they can. So we know, even for Boston, that there are things that need to be done. That would be a long conversation, and I see a list of hands, but I'm happy, if people want to just get together and think about what we can do more, I'm happy to get together again to talk about it.
And I typed in the chat The next person would be Dusay. And then you have the order there in the chat.
Thank you very much, Wesley. And again, thank you so much, Dr. Izandazzoni. I'm just a formal person, so I apologize. But yeah, I want to thank you first. Excuse me. I want to thank you as well for your presentation. I have to say, unfortunately, so I'm in medical field as well, and I have to say, unfortunately, I'm not surprised with the numbers. I've seen some of this when I want to say in hospitals, but as well as in small practices. And I remember, I'm just going to share the story because this speaks volumes, especially in relation to your statistics. This was a few years ago. Now I was doing an externship, and I was following another assistant, and there was a patient who was on the autism spectrum, and I don't know why, for some reason he was having, I'm going to rephrase this. So we were doing a procedure on him, and he was getting, I'm assuming he was getting overwhelmed, and he started using hand gestures. And I'm not sure if he was able to speak American Sign Language, but he was using hand gestures to explain his needs. And the assistant I was with, she did not want to pay attention to the hand gestures. She wanted him to communicate verbally. And I thought, this is not right. Why if that's his way how he wants to communicate, let him communicate that way. Trying to understand him, trying to help him in this during this medical appointment. So it's obvious that you should be able to try to accommodate him. And that's why I'm not surprised, unfortunately, with your survey. And I just want to echo kind of Jerry's question. Why is this happening? Why is the medical professions? Why are these some medical professionals? Why are they not? Why is it so hard to get an interpreter? Why can't they provide? Or why are they not? Why do patients not want them to provide an ASL interpreter? Is there miscommunication? Why is there so many? I want to use the word friction because that's what it feels like to me. So why is this happening? Is there a reason? Had anybody spoken to the patient? Or is it that you don't trust the doctor, or ask the doctors, why are you doing this? Something in that form. That makes sense. Thank you.
Yeah, that's why I emphasize the results relating to people who are deaf or hard of hearing, because I found it shocking that 50% of doctors never have hired an ASL interpreter to come to their office. Now, I have given talks all over the country to doctors groups, and what they'll always tell me is that what they get paid for the office visit is less than what they have to pay to hire an ASL interpreter to come. So they feel that they're losing money every time they have an ASL interpreter. But guess what? I suspect that some other might not take that much time, and so they make money on other patients. It's just not a valid argument to make, okay? But it is true, when you look at it, that a lot of places require that you hire an ASL interpreter for like 2 hours. You can't just hire them for an hour or something like that. And so it is expensive. Again, I don't think it's a valid excuse, but there are places around the country that are beginning to see whether there is some way to handle this expense, because in fact, the costs of all accommodations are supposed to be borne by the practice. They can't be charged to insurance. They can't be charged to the patient. They have to be borne by the practice. Again, I think that that's a pretty weak excuse for not hiring ASL interpreters or not using remote video interpreting. which we know from people who are deaf is not as preferred as having somebody right there. But that's what physicians will tell me, is that it's the cost issue. Let me just say that people who track ADA lawsuits in healthcare, communication problems are the reason for some of the most common ADA lawsuits. And so it's not a good idea to not have effective communication, because you're going to get sued, and rightfully so.
Thank you. Carol? Carl, sorry.
Hi, Lisa, how are you? This is Carl. I don't think we've seen each other since London. So I'm thinking, what was the root of the problem? And I'm thinking, has there been given any thought as to trying to develop a curriculum to teach medical students the issues regarding the ADA and the obligation? And it goes beyond understanding the ADA, because the ADA code, having a table at adjustable height, providing, communication access, but it also is how we are perceived as individuals, that we're not broken, we don't need to be fixed, we just want to be healthy. So has there been given thought to trying to do this early before they become doctors and go into a long career and get set in their ways?
It's a great question, Carl. And yes, in fact, there has been recently a lot of effort about developing what they call disability competencies. Medical training now is all about competencies in how you treat different types of conditions. And there's a group out at The Ohio State University in Ohio that has really been doing a great job on this. They're not just focused on physicians, but other healthcare professionals in training, like nurses, physical therapists, occupational therapists, speech language pathologists, and so on. And what's been great about what the state people have been doing is that they've also brought in people with disabilities to be part of the conversations, as well as some of their caregivers. And so it's actually been a really great initiative. However, whenever I talk about this, I always talk about what in medical education is called the real estate. How do doctors in training need to learn today? You need to learn everything from molecular biology to precision medicine. And so do you have time for like an hour about disability? That's one of the biggest problems, is figuring out where to fit it into the curriculum. And trust me, I know, because I've often been the person who's given the 1 hour lecture that medical students over the course of the 4 years will ever have. 1 hour isn't enough. And so my feeling is that a lot of medical education now is quote unquote case-based training, where they talk about cases of asthma, cases of diabetes, cases of heart failure. Well, guess what? Every single one of those has a disability component to it. So if you're going to talk about cases by disease, bring in a comment about disability for each of them. And so I know that that's something that Harvard Medical School is starting to try to do. But, the other thing is that it takes 7 years to make an internist, okay? 4 years in medical school and 3 years of postgraduate training. We don't have time to wait to replace all these ableist physicians if it takes 7 years to train a whole new batch of them. So we need to start thinking about whether continuing medical education and regulations for licensure, renewals, and so on can begin to require that practicing physicians out there also have some teaching about disability. And I'm acutely aware of the time because I know that you've got a busy schedule, and so Wesley, you need to tell me when it's time to stop, okay?
Okay.
Okay.
We have time for a few more questions. So I'm going to call on Elizabeth.
Hello, thank you. So nice to see you again, Lisa.
Yes, hi.
Dr. Iazoni.
Oh, come here, Lisa, please.
Yeah, this was very helpful to, having read the articles in print, that will give the context, and even things like that there weren't the funds to include. These were the most important specialties that many patients with disabilities will come across. But of course, as we all know, people with various disabilities might have skin issues and need a dermatologist. And so all those issues about tables, practices that really even, at least some neurology practices and some perhaps orthopedic practices have accommodation, although I think orthopedics, ironically, even for some patients, it's a shorter term problem. In some specialties, it seems, or GI clinics that don't have any kind of scale, a way to know if someone's accurate, right? I know Jerry had already asked about ways we can help, and I appreciate you invited us to pursue that further. And certainly Zari continues to very actively help at MGH. But I did want to follow up on the point about education. I think that's an excellent idea about continuing education, because although Tufts has had a program for more than 10 years in the third year family medicine clerkship, where they interview standardized patients who have either both a physical in one setting, it's someone with a physical disability, whether it's that they're in a wheelchair, they use crutches, they use a guide dog, and in the other case, it's somebody on the autism spectrum. And that, I think the students always, rate that well. The evaluation is well received because they know these are people with lived experience. But I do think training Dr. Hood, that's a very important piece about continuing ed. And on that, in thinking about that, at the end of the focus group, did you self-identify? Or
No.
was, okay. No. I wearing your professional hat, I don't know if that seemed like a conflict to you, but.
Right, well, what I wanted to do in the focus groups was to create a safe space.
Oh, sure.
So that the physicians would feel free to say whatever they wanted to. And I'm very good at having kind of a blank expression on my face. So as they started saying all these unbelievable things, I was just like, that's really interesting. Why don't you tell me more? And so they did. They said more terrible things, but the point is to not make them feel threatened, but to make them feel safe so they will say what they naturally would want to say. And so that's why, our focus group findings were, really troubling. Because that's what physicians wanted to talk about when they talk to each other about people with disabilities.
Yeah, well, I look forward to further opportunities to just discuss this. But thank you again for the opportunity to present to us today and for us to give you some.
Thank you for having me.
Okay. Richard, do you want to say something?
Yes, thank you, Wes. Lisa, we've never met, but I have to say how your study is so important. The people on this commission are a wonderful, committed group of people who have insights into the kinds of issues that you've studied that unfortunately the general public doesn't have. And I don't think, hopefully folks will agree with me when I say this, that there's no one on this commission who doesn't feel for the issues that you've outlined in their kishkis, if you know what kishkis means. I actually have a proposal for action. I think it was Jessica Bartlett wrote in October 6, she wrote an article in the Globe. Your study obviously preceded that. I mean, these are not small issues. I mean, there are people, I mean, I don't even know how many, probably thousands of people in our city who are not able to live the lives they should be able to have, and the length of time they should be able to live because of the types of issues that your study brought to light. I was a little, there was a little curveball for me, and I'll tell you in a second when you said it was a national study. I was kind of hoping it was a Boston study. And I believe that when you have action, it needs to be fact-based. So I actually have a proposal I'd like to ask you about and then see if the commission might actually adopt. Because I don't think the issues you've raised should wait a minute longer. And so my proposal is that this commission votes to have the Boston City Council commission, maybe if we have to run this through the mayor's office first, fine, the Boston City Council to commission a study, a Boston study, and perhaps engage you to do it. I have no doubt, zero doubt, that they will find it. We might do it a little better than other places in the country, but I have no doubt we're not perfect, and that what they'll find in Boston is at least approximate to what you found nationally. And I don't want to speak for everybody, but this is so disturbing to me that I think we need to do something about it, and I think we need to do something now. So my proposal is that we ask the City Council to authorize a study for this, and somehow we come up with the money, and I would be delighted, it makes sense for you to be hired, of these issues in Boston, and then to hold public hearings on legislation that would address these issues. And I don't know what that would look like, and I'm sure that doctors will want to appear, and we'll get, there'll be a lobbying thing, and all that goes on there. But that at the end of the line, this City Council, which I think is more sensitized to these issues than maybe previous ones, might come up with something which I'd be shocked if our mayor didn't embrace wholeheartedly, that says, doctors have to do in the city of Boston, if you want to practice here, the following things, whether it's providing translators, whether it's making sure they have the proper equipment, whether it says that they cannot. It's pretty unlawful. I do a tremendous amount of civil rights work and have in my life. I'm pretty sure turning down a patient who's disabled is unlawful, and I think you had one of your slides talking about that requires those who want to practice in Boston to have certain equipment, and I don't know what else because I don't pretend to be an expert on what's needed. So I'm wondering what you think of that. Wes, I don't know what the internal processes are for doing something like this. But I would say to my fellow commissioners, who I think I can say confidently feel these kind of issues in their kishkis, that we should do something about this now. And I don't know that we can do anything more than that, particularly as a commission, but I think we should at least do that. And that's my recommendation. And Lisa, I wonder what you think of that, and I wonder what other commissioners may think of that.
Well, as I said, I've been toiling in this space for 25 years, and I've focused primarily on primary care, reproductive health care, and cancer care. And in all of those areas, I have found, my last study was this survey. Every other study that I've done before this has been talking directly to people with disabilities. And I've been the one who's done the interviews because I love interviewing people and hearing their stories. And to Elizabeth's comment, when I do interviews with people with disabilities, I do self-identify as having a disability because, you know, it's just helpful to me for them to know that I have a disability. Let me just say, Richard, that I think that, and Zari can speak to this as well, there has been an effort since 2009 by Greater Boston Legal Services, along with Boston Center for Independent Living, to try to get at least the big healthcare providers in Boston to be a little bit more sensitive to this issue. The place where I couldn't get onto an exam table, though, is one of these places. So obviously, they still haven't got this fixed yet. But I think that, and I also know that Disability Law Center and GBLS have been talking to Mass Health about making sure that providers that are contracted with Mass Health have accessible equipment. You know, how about the ASL interpreters, though? You know, so I think that there are a lot of layers that you would need to know first what people have already been doing out there and where they faced roadblocks. Because I know that some of these legal efforts have come a cropper. You know, they haven't succeeded. And so what have been the barriers to moving forward on this? So I think, you know, Kristen says in the chat that she's been involved in this. And so maybe, you know, when I leave, you guys can privately talk about where this might go. But I think that certainly there are some good things that I think are maybe about to happen, and that is that the Executive Office of Health and Human Services is thinking about new data collection standards for disability. Because although we collect information on age and gender and race and ethnicity, we don't know anything about people with disabilities in the state. And so we can't do anything until we've got data out there. And so, you know, I'm hoping that, and Massachusetts Health Quality Partnership, they've recently emailed me that they're going to try to collect data on disability for their efforts to look at quality of care at private practices. And so we need to kind of do an inventory of what we've got, what we don't have, where the gaps are, and then really figure out, based on that kind of assessment of where we have faced barriers, try to figure out where to go. Because I agree, I mean, it's been, you know, it's been 50 years since Section 504 required anything with federal funding, like Medicaid, Medicare, 50 years. You know, people keep talking about the ADA, but I go back to Section 504, you know, and so, so there's just a lot of work that I think remains to be done, and we hear stories about that this evening already, so.
Lisa, we've just met, but I already love you. But
And again, call me Lisa.
Okay, I think that's the least that I should be able to do, right? What I'm talking about is gathering data.
Yeah.
Relating to the city, not, you know, plucking it from here or there, or who's doing what, and which I think could be quite a task to accomplish. Commissioner McCosh and her staff have a lot on their agenda. My idea is to suggest that the city council take this on. We're all volunteers. We have other jobs. It's not, I don't think, within our ability as commissioners to do this research.
Yeah.
So I'm looking for a way to address this that isn't piecemeal, that's comprehensive, that someone can do. I cannot believe that we could not persuade the city council, if that's the way to go here, that this isn't a worthwhile endeavor.
Hi, Richard. It's
Sure.
Kristen McCosh, the commissioner. I just want to jump in to add a little context and guidance. So thank you so much, Lisa, Dr. Iazzoni, for your really enlightening presentation. And when we first saw your article a few months ago, as you said at the beginning, like, you're preaching to the choir. We know this is the way it is. We were not surprised. Some of our new board members may have not been as aware of the issues, but those of us who use wheelchairs like myself were acutely aware of these issues. But just to see it in black and white, really, it drives the point home. So, Richard, I understand when you see it, it's so infuriating and it's so unfair, and it goes against people's civil rights that you just want to, you have the urge to do something. But I think Lisa gave some really, some good wisdom when she said, like, let's look at what's already been done and what people are doing now. Because if we can certainly raise issues with the city council, but we just want to know what we're doing. Because if they raise a hearing, what's going to be the end result of the hearing? Like, we want to, like, BCIL is an awesome organization. They do advocacy on independent living. And I've been involved in their work on advocacy with the big hospitals for over 10 years, probably 15 years, as Zari has as well, I know, and Jerry. And we did work with the big hospitals. One big accomplishment that we got was to allow PCAs to actually do care in a hospital, which is a huge barrier for people like me and other people with more severe disabilities. If you can't have your PCA come in and treat you on the floor, care for you, it's very disruptive to your health and well-being. So even that was a huge accomplishment, but it's just one of the many barriers that we have to work on. So I think that from this conversation, we can think it through a little bit more about what the next steps are. But one next step we could be is we can circle back with BCIL and see where they stand right now, because as we've all said, this was a long time ago and we did make a lot of strides. And then we fell back a little bit. I know Zari works in the field, and I think her appointment actually came out of the work that we did with MGH. And so I think we can circle back, see where we stand, and then see, get input from these nonprofits. What do they think we should do? Like, how can we help?
Look, if the commission thinks we need to do more homework or check out different things before we move forward, then so be it. I just think this is something that can't really wait. So if we're going to do that, let's do it fast. And let's get to the bottom of whatever it is folks feel they need to know about what's going on there as soon as we possibly can, and let's do something about it then. Let's not wait. And the article that I saw in the Globe when I brought this up at the meeting was October 6th, okay? We're almost, 4 months later? That's 4 months where people have had to live with what Lisa reported on and what her study involved. To me, that's a third of a year lost for lots of people. And so if the commission feels that we need to check these other things out, fine, but let's do it as expeditiously as humanly possible, and then let's do something about it.
And I see in the chat there are some suggestions from board members. I could turn it over to Wes or Andrea to talk through those.
Yes, we can read Andrea, can you read the chat, please?
Yes, of course. This is Andrea. Olivia Richard put in the chat, this sounds like a chance to write a letter to the Boston Public Health Commission to say we want them to look into this. And Wes, you noted we could write a letter to the Massachusetts Board of Registration in Medicine for further action for those who dispute at specific physicians for discrimination.
I think those are great ideas. I would not discourage it for a second. Let's do it if the commission's permission is granted.
Would that be a vote?
This is Andrew. Oh, yeah, Wes.
This is Wes. I don't want to interrupt. I'm looking at the time, and we are beyond time. We need to move on to the other items on the agenda. I want to respect everybody's time this evening. And again, I do want to thank Dr. Izoni for sharing your statistics and the information with the board and allowing us to gather more information to collect our thoughts, to review further actions that we can take at the next meeting. I think we can table the discussion and go further with this under new business for next month. And that will also give people time to think about other resources and to see what others are doing. If you have any questions, you can reach out to Lisa Izoni directly. Her email is there.
Thank you. Thank you again for having me. I was delighted to be here, and you guys are doing good work. So thank you.
Thank you.
Thank you, Lisa.
Thank you.
So there's agreement in the chat. This should be on the agenda for the next meeting.
Charlie, I think you couldn't.
Let me look at the agenda. It's time for the chair's report. There's 2 items for the chair's report. One, of course, is the passage of the captioning ordinance. And I was excited to see when I came back from vacation along the sidewalks, as I was passing the restaurants, I could see through the window and notice that a lot of the local businesses were engaging their captioning on their televisions. And I could see most places were providing the captioning. I did notice a few businesses had yet to do that. And I am hoping that with the addition of further posting and dissemination of materials from this commission, along with other city offices, we can make headway with this. And that all businesses will take it serious and they will attend, because it does have nationwide attention. It's been in the news, several newspapers, and on social media. The Washington Post, for example. I was contacted by a friend who lives in DC, and she admits that she really wishes Washington, DC would do this. Washington, DC, it was one of the homes to the largest deaf community in the United States. And you would think that they would be the leaders in this, but it's been done in Boston first. So that's just some information that I wanted to share and what I see happening in the community in compliance with this. The second is the Boston Herald. There was an article last month about people with disabilities facing employment discrimination. There was the disability employment under the commission. on status of persons with disabilities, the subcommittee on the Commission of Status with Persons with Disabilities, and they recommended improving opportunities for those living and working in Boston area. You can read the report for their subcommittee. That's on a state level. There's some incentives for tax credits for people to hire people with disabilities. I wanted to highlight this as an idea that I hope could see happen in the city of Boston as well. And I really want to hold this idea and discuss it under new business. But is there any questions on my report and specifically for the new captioning ordinance? Carl, you're on mute.
This is Carl. Based on the success of the Boston Captioning ordinance, I have been meeting with a number of legislators at the State House, and the deadline for filing bills is actually this Friday, and 2 legislators will be filing bills on trying to make this captioning mandate statewide. Senator Michael Barrett, who himself has a child who is part of the, who is either hard of hearing or deaf, and then Representative Denise Garlick, who is actually the chair of that commission that you just mentioned, the permanent status of persons with disabilities, will also be filing a bill. So I just wanted to let you know, based on the work that this commission has done, that it has gotten the attention of the State House. So thank you.
That's great, thank you. And hopefully hopefully that legislation will pass. And hopefully it'll happen sooner than later. So I'm not sure if just
Jerry, you have your hand raised?
Yeah, just to piggyback on what Carl said and to ask a question on that. How can we support this, Carl? Is the best advice to wait until there's a bill filed and then maybe submit a letter in support, or what are your thoughts in terms of how we can help push this forward?
This is Carl. I would wait till the bill gets assigned, till the bill gets assigned to committee, and at that point, we can reach out to the committee members and do a letter of support.
Can you keep us informed?
Absolutely.
Excellent. Thank you, sir.
Thank you for letting us know about the bill, and just keep us informed on when it's being submitted and whatever contact information we need to see about how we can support the bill.
When it goes to committee.
Okay. Now, is there any other questions regarding the chair report? Okay, so I'm gonna turn it over to the commission's March report.
Commissioner McCosh.
Thank you.
Thanks, Wes. Just wanted to check, do we not have a member spotlight this month? We don't? Okay.
No, we don't. It's not on the agenda now.
Great. Okay, Andrea, could you share my slides? Thank you. All right, so my report this month is fairly brief. Some City of Boston updates. As Wes said, he's noticed some TVs with captions on. We've also heard that on social media, and we've had calls, and just anecdotally, we've also heard that a lot of people are seeing the captions turned on, so we're really excited about that. We're working on finishing our outreach materials, and once we do, we'll be doing a mass mailing and an email blast in coordination with several city departments to make sure we reach businesses in every neighborhood as well as downtown. So the materials that we're working on include instructions on how to enable closed captions, FAQs, the city departments who are involved, and contact information in those departments if people have questions, although our office is certainly the lead department, so we will emphasize that. And then we're also going to have a link dedicated to a closed captions information webpage that will be linked to our website. We have the draft web page finished, and as soon as it's live, we will spread the information widely. So we hope that you will all work with us to get the information out. One other piece of outreach material that we're producing is the wallet-sized cards, just explaining the ordinance, so that you can share them with businesses if you go in and they don't have captions turned on. So stay tuned for more information on outreach materials. Next up is the Boston Public Schools. Many of you may know that Mayor Wu is working on what's called the Green New Deal for BPS. And this is looking at everything from the building environment to sustainability for the planet and the economy and being financially responsible. So it's really an overhaul of the whole way that Boston Public Schools are built and arranged and will be working moving forward. So in order to really come up with a solid plan that the community is involved in, the city's going to be doing 9 community listening sessions. 7 will be held in person, 2 will be on Zoom, and they're all open to the public. In addition to the general sessions, they're also going to hold one smaller focus group just for people in the disability community. And this is going to be by invitation only. So if any advisory board members would like to attend, please let us know. And that's going to be more of a discussion, people with lived experience, people with kids in the BPS who may have disabilities. We really want to get that lived experience input. And we'll follow up with dates very soon. And then last update citywide is that the mayor's State of the City, her inaugural address will be next Wednesday at 7 p.m. It's being held live at the MGM Music Hall near Fenway Park. All advisory board members should have received an invitation. And if you haven't, let us know, but we ask that you RSVP as soon as possible. And if you need to request any accommodations, you can email stateofthecity@boston.gov. I know that ASL has been requested, and it should be available. So if you need any accommodations or want to talk to us about ASL, please send us an email. Okay, next page. All right, so we were just doing some planning and a meeting today. Since it's January, we're looking at the whole new year ahead of us, and we outlined some dates for our main events. So in January, I mentioned we're going to be working with BPS on the Green New Deal listening sessions and the Disability Community Focus Group. In February, every year we do free tax prep for people with disabilities, including a series of what we call deaf tax days, where ASL interpreters are paired with people who are deaf in order to get their taxes done. And this year, the Disability Committee is working on a pilot for blind tax days, where they have sighted guides who are able to help read the forms to people who are blind. So stay tuned for those dates in February. In April, we'll be kicking off our bike outreach campaign that's been in the works for a long time. We're in the process of getting our final materials from the consultant we've been working with. The materials will include videos, photos, animated video, posters, coasters, stickers, and a whole lot of messaging that we'll be working on. So we're going to hold a public kickoff probably on the plaza sometime in April. So again, we'll be following up with more dates. We don't have many dates yet. We're just kind of mapping out the year. In May, we do an annual Disability Community Forum every year, where we invite people with disabilities or people who are just interested in disability issues to come out and tell us what's working, what's not working. We like to listen to them, and that helps us set our agenda for the year. Usually we'll bring the board will attend so that people can meet the board, ask you questions directly, get to know who you are and what you're working on. They get to meet the staff of the commission. And very often we have city officials attend as well. Mayor Wu came last year, so that was really exciting. She may not make it this year, but sometimes like the public health commissioner will come if there's a lot of work going on sidewalks or things like that. So as the date gets closer, we'll figure out who is going to be attending from the city. But we'd like to just put it a little pin in it for you, so you keep it in mind to hopefully attend. In June, for the last few years, we've been doing a transition age special education students financial empowerment day. We bring a couple dozen students out to City Hall, and we match them with banks and investment institutions so they can learn about banking tools, like what's a saving account, what's a checking account. They're trained on predatory lending practices, and we were able to give them all seed money of $100 to open their first account. So it's a really exciting program. It's part of a grant program that we're wrapping up this year. So this may be our last year of the seed money, but we hope to be able to pass this program off to BPS and have them continue it. We've had a lot of BPS teachers trained in the curriculum. The curriculum is from the National Disability Institute. So it's a really great program, and the students have really loved it. And we also have a nice parents so they can learn about it. And there's a lot of really great tools that, parents and students may not know about. Things like ways you can save money even if you get benefits, so that you won't risk losing benefits. And, there's certain ways you can do that. So, very exciting program, and we usually do that in June. In July, we'll be celebrating our 13th annual ADA Day. This is our big event on the plaza where we pick someone who's done a lot of really great work over the last year to honor and celebrate. And we do resource tables from disability organizations. We have our famous t-shirts, we have our famous hot dogs, and it's just a really fun day with music and a tent and open to the whole community. Every September, we do a Disability Civic Engagement Day, where we bring people to the 5th floor in City Hall. They get to tour the City Council chamber, learn about testifying at a hearing. They can register to vote and demo a voting booth and the AutoMark machine that helps them vote accessibly. They can meet their neighborhood liaisons. They can meet their city councilors. So it's a great way to get people with disabilities into City Hall to encourage them to really be involved in local government. And then October is National Disability Employment Awareness Month. That's a national initiative that was started many years ago in Washington, D.C. So we participate in that every year. And we usually do Disability Mentoring Day, which is a big event at City Hall, where we bring in a number of job-ready adults with disabilities to do a day of job shadowing, mentoring, signing up, training through human resources on how to apply for jobs with the city. And then recently, over the last few years, we've implemented a Pathways to Employment program, and that talks about ways to get a job in public service, specifically with the city of Boston. So that's our work in a nutshell, our big events in a nutshell. Stay tuned for specific dates coming soon. And then this slide is it's repeated from last month, but I just wanted to reemphasize that the Office of the Inspector General has training that you can attend. There's a small fee, but you can be reimbursed. I know a few of you have taken us up on that, so thank you for that. And then just making sure everybody has the 2023 board meeting schedule. Again, it will be virtual for at least the next 2 months, and then we will find out more about meeting in person after that. And then just to go over some advisory board information, I know a lot of members right now are on holdover terms. So we've been working with the mayor's administration to get more information about reappointments and swearing in. So we know that that information will be coming soon. So as Paulette mentioned, she hasn't been sworn in yet, but once you get a reappointment letter, you'll be able to come into City Hall. You have to come in person and get sworn in and sign the book, and then you will officially be reappointed for a term. The way it's going to work, though, is not everybody won't be the terms are 3 years long, but everybody won't have 3 years from the day of their swearing in. It will be 3 years from the day that their original term expired. So if you've been a holdover for a year, once you get sworn in, you'll be sworn in for a period of 2 years. But we can go over that individually if people have questions, and we'll have more information definitely in the next week or two. And then I know there's been some discussion about enabling legislation and bylaws. So just wanted to let everyone know that we're working with the Mass Office on Disability and the City of Boston Law Department to clarify some questions that have come up. And we will get back to you with more information on that. But one thing that I did want to just go over really briefly, just to emphasize that the focus of this board really is, I don't want to get bogged down in like semantics, but really to look at what the responsibilities of the board are. So board members are here to advise and assist municipal officials in ensuring compliance with federal and state laws, review policies and activities of municipal departments as they affect people with disabilities. And on that bullet, I really want to emphasize that that's the reason why we do presentations every month. Like when someone from Public Works comes in and talks about a new street they're designing, we do these presentations not just for your information, but so you can weigh in on them. And we try to find, relevant ones where we think, oh, people with disabilities really need a seat at the table for this project, whether it's like redoing the library in Copley or something like a policy like the Elections Commission is redistricting. So that second bullet I really want to emphasize is one of the main reasons that we do have presentations at the meetings. That is the time when you can actually give direct input to municipal departments so they understand the needs of the disability community. And then just the other ones are the information referral, advocacy, and technical assistance, and then coordinating activities of other local groups. And I think that came up tonight. It's a really great example of how you can coordinate with BCIL to say, oh, hey, we read this report about discrimination of people with disabilities in the medical community. How can we work together, or what have you done, so that we can really take a stand to ensure that this doesn't continue. So those are the board member responsibilities in a nutshell. And then also our bylaws call for annual elections of the executive committee. So there are 4 positions. There are chair, vice chair, secretary, and treasurer. All members are eligible to serve on the committee in any role. So if anyone's ready to nominate anyone tonight, we can do that. Or we can do it after tonight's meeting, but we will schedule the vote for February. And then to wrap up my report, my staff did a really good job on making a slideshow to wrap up 2022. We didn't get to show it at the last meeting because we ran over, but we'd like to show it to you all tonight. We had Christmas music with it, but I think maybe we don't have any music tonight. So we joined the Equity and Inclusion Cabinet. We moved from Human Services into Equity Inclusion, and we're really excited about that because we get to work with all these other offices that really work on systemic access, which means we don't provide services, we work to make sure everything that the city does has an accessibility lens in it. And then we received an extension of an ADA municipal grant. For new members, you may not know, but we applied for and received a $250,000 grant from the Mass Office on Disability to replace the incline lift on the 3rd floor mezzanine with a vertical lift. So we only had a year to spend the money, but we were able to get an extension, and that will be installed before June 30th. And then we held our first in-person Disability Community Forum since COVID-19. Over 150 people came out to talk about disability issues, and newly elected Mayor Michelle Wu attended, as I said earlier. Boston Public Schools facilities, we're working with the Green New Deal team on assessing and analyzing ADA accessibility of all current buildings and looking at when they get to the design phase, we'll also be giving input on that. We created our Boston Breaks campaign for bicyclist safety and when interacting with people with disabilities. That's the launch I talked about in May or April, so stay tuned for that. We held our 12th annual ADA Day celebration on City Hall Plaza. We ensured access during the MBTA Orange Line shutdown. We worked really hard to coordinate with the T and with Public Works to make sure that sidewalks where new bus stops were located were accessible. And we created an accessibility guide. We had a web page with information. I have to give credit to my staff. They did a ton of work on this project, and for the most part, it was successful. It wasn't easy, but for the most part, it was. We did maintain accessibility. Sarah Leung, our Senior Architectural Access Specialist, won the Lemuel Shattuck Award last year. This award is given out to municipal employees who show exemplary public service. Congratulations again to Sarah. We held our first person civic engagement day since COVID-19. Over 100 people came out to the City Council chamber to learn about getting involved in local government. And we're working with BPS programming on the financial empowerment program that I mentioned. We held a session on ways to get involved with the city budget. Mayor Michelle Wu appointed 2 new members to the board. Welcome to Charlie and Richard. We hosted our Pathways to Employment webinar. We celebrated the reopening of City Hall Plaza. It was a long time coming. We attended the Earthshot Award ceremony. Board Chair Wesley Ireland got to meet with Mayor Wu because of his advocacy around the captions ordinance. And the caption ordinance passed, as you all know. And that's it, just a brief overview of some of the accomplishments from 2022 and looking forward to doing just as much in 2023. I'll turn it back to you, Wes.
Denise, you're muted.
Interpreter, you're on mute.
Denise, you're muted.
Interpreter, you're on mute.
Thank you, Commissioner. I look forward to what's happening in 2023, and the review of 2022 is nice. I see a few hands, and if we have a couple questions. The first is Richard.
Yeah, thanks, Wes. I'm wondering if there's some way that those of us who are going to go to Mayor Wu's State of the City address might be able to be together there, whether it's sitting together or being in the same area at the MGM Center. None of us, at least since COVID, I believe, have been in each other's presence at all physically. So I'm just wondering if this might be an opportunity for those of us who are planning to attend might actually meet each other in person.
This is Andrea. I believe there will be assigned seats, so I can check on that. When you registered, if you noted that your affiliation was being with the Disability Advisory Board, then likely they will seat you together if they're assigning seats, but let me confirm that and I'll get back to you.
Yeah, I don't think when I registered there was that feature, but I could have missed it.
Jerry, and then Charlie.
Yes, my comment was in regards to the State of the City event coming up too. I took Andrea's suggestion because I emailed very excitedly as soon as I got the invitation saying that I wanted to try to attend, and she suggested that I email that email that was in your report earlier, Commissioner, stating that I needed wheelchair seating. I just wanted to let you know that let you and Andrea know and your staff that I haven't received anything back yet, and so I just want to make sure that those of us wheelchair users who are invited and planning to attend can find our the wheelchair accessible locations pretty easily. So I don't know if you can check with the mayor's staff or the staff of the event and confirm that wheelchair users can be accommodated.
Hi, Jerry. I'm so sorry you haven't heard back. I will definitely follow up. When we gave the board members' names to the team to invite. We did share, we did disclose your disability to the extent that you all disclose it here in this public forum. So they should know which, those of you who have, publicly noted that you're wheelchair users, they should have that noted. But they should still respond to you. So let me see what's going on there so that I can make sure we get that confirmed.
Yeah,
I could just let you know, when I went to the MGM Music Hall for the Earthshot Awards, they do have plenty of wheelchair cutout sections so that you can pull right up to a rail. So it's very accessible.
Yeah, that's what Andrea said when I emailed. I think you were out, Commissioner, but she did say that you had attended an event. I assumed it was Earthshot, which I'm very jealous about. I'm glad to hear that it's accessible. Again, I just want to make sure that those of us who need the wheelchair accessible spots can find find our locations easily, and then sit as comfortably as possible at the event. That's all. And I just had one other comment. And I was delighted to see the mayor at so many of the events that you highlighted and that we were at together. And I know you said that in your report that she may not be able to attend the community day in May. I hope that's not set in stone, because I think it was great to have her there, and it will be great to have her at as many events as possible. So I hope that she's still able to attend as many of our events as possible.
Yeah, it's definitely not set in stone. And I will say Mayor Wu makes a real effort to attend our events. And I'm sure every department feels like that, but she really does. So, stay tuned.
Great, thank you.
Charlie?
Hi, I have a question, Commissioner, on the slide where you had some of the roles for the advisory board, and then kind of crossing over into the work and the collaboration that you're doing with Boston Public Schools for the Green New Deal. Is our advisory, because I know that we had talked about it's a quasi-entity, the BPS basically. Is our advisory mainly on the architectural, or what is that role that we're really pushing? Because it's kind of dovetailing into the question, I know that the hot button question of transportation, but it's more of the when in transportation, I know the city owns the buses, so there's that issue of mechanical issues for some of the maintenance on wheelchair lifts, on rails and all of that. I was just wondering, what is the advisory board's ability when you do talk about a violation of certain laws and compliance? Where do we have in that role, so that we're channeling the right messaging, or if we aren't part of some of these listening sessions, so that we can effectively communicate that across? Hopefully my question makes sense.
Yeah, and I don't think it's a black and white line. I think it's a little bit of a gray area. A few things that we've noted, I know when we had a conversation offline about this, are that, the Disability Commission, one of the things it's tasked with is really looking at compliance with laws. And when we think disability law, we usually think ADA. And because I'm the ADA Title II coordinator for the city. So as we mentioned to you, ADA isn't the most applicable law to schools, to K through 12. There are other, like the IDEA and other education laws that are more relevant and more impactful. So there isn't a lot that we could do, like program-wise. But that being said, my architectural access staff does work with the facilities department at BPS to make sure that architecturally they're compliant with, again, it's not so much ADA, it's the state building code for access, which is 531 CMR. So where the board would fall in, I think is, like I said, it's a little bit of a nuance. I'd suggest going back, reading the responsibilities. We could think it through before. We haven't really had board members who have been like specifically interested in BPS as much as, you know, you seem to be now. So I think we're still kind of figuring out as we go. That being said, we are much smaller and less able, have less capacity to do a lot of work than the school committee would have. So I think we need to kind of think it through a little bit more. Anything you'd like to add, Andrea?
Yeah, I would just say that because we have two architects and one engineer on staff, our department has focused a lot on the buildings. And so to the point of the slideshow, that our department has been doing a lot of architectural access review, and that's why we highlighted that in the spreadsheet or in the slideshow. But this board can certainly, you know, advise and assist and recommend and advocate and all those kinds of words that are in the bylaws and the enabling legislation.
Thank you.
Thank you, Commissioner McCosh. I'm going to move on to the next agenda item. Patricia, for the architectural access report.
Hello, everyone.
Thank you.
Thank you, Chair. Good evening, everyone. My name is Patricia Mendez, and I'm the Director of Architectural Access for the Commission. And this is a brief architectural access report. Welcome, Paulette. It's nice to meet you. So I just want to talk about two things. The first one is a transportation initiative from the BPDA, Boston Planning and Development Agency. They're working really hard on the South Boston Transportation Action Plan, and they have asked us to distribute their studies and ask us to provide comment to them. After the meeting, we're going to share the links to these three things. One is the recording for the public meetings that happened on November 14th. So that's one thing is the video. The second thing is the slide presentation that relates to that video. And the third one is a whole report on the analysis done by their consultant. So it's a really robust document for you to get into, review, and provide comments by email to Eileen Michaud at boston.gov, and we're going to share the link for those three documents and the emails to provide the comments. Great. So the other thing that I wanted to mention that we talked about last year was the Advanced Community Access Monitor Training. We call it the ACAM. That has been rescheduled for April 12th. And just to recap, that is a free training for this commission, and it's half a day, and it's free, and it includes great information on the accessibility code and some ADA information too. And I'm happy to follow up with more information on the actual training and how to sign up, which is through me and through MOD, Massachusetts on Disability, Commission on Disability. And with that, I'm happy to answer questions on those.
Okay, I don't see any questions for Paka. So thank you.
You're welcome.
Okay, so we're gonna jump to old business. And welcome I'm sorry.
The welcome letter from Governor Haley.
Okay. So I have sent out at the end of December, I sent out an email regarding the letter and for all of you to review. And I think it's really good and it's ready to go. So I'm going to open the floor for any comments or any last minute revisions. If there's none, I want to make a motion to have the letter approved. So if there's no revisions or any comments, so I see that Richard and Jerry both have their hand up. You want to go ahead, Richard?
Sure, thanks, Wes. And as you know, I had something to do with revising the letter, but I cannot vote for the letter the way it's written without changing advisory board to commission. And because I think that's who we are. And it's as, there's a lot to be said about that. I received some emails just a few minutes ago saying we were going to talk about this next month, and we weren't going to talk about it tonight. I'd very much like to explain it all to everybody tonight because I think it's significant, but if we're not going to talk about it tonight, I just want to say that I cannot support the letter as it's written with that discrepancy because I think it's violative of the statute that we exist under, and which requires, I think, a much longer discussion, and I need to be able to show people what I'm talking about on the screen. And I have the materials in front of me, but I understand I'm not supposed to bring it up tonight.
So Richard, I can jump in and just say, Wes, if you or I don't know Wes, but if anyone wants to make a motion, you can abstain from voting. That's fine, Richard.
No, I'm not going to abstain. I'm going to vote against.
That's fine.
Sending it. But I'd like to be able to explain why, but it'll take me a few minutes to do it. If Wes would allow.
We only have about 20 minutes left. I ask you to be like a really short comment because I know that there are 3 other people that have their hand raised.
Okay, so Les, I'll try to do this as quickly as I can within a few minutes. The statute that establishes the commission, which is Chapter 40, Section 8J of the Massachusetts General Law, says, a city which accepts the provision of this section, and I'll just give you the major words, may establish a commission on disability hereinafter the commission. Such commission shall, and it gives its responsibilities, and it uses the word commission 9 times. Other materials, the Massachusetts Office of Disability, if you look at their materials, and I could display them if we had more time, instructs on what we are to do and who we are. Their materials make it very clear that we are a commission. I think there are something like 14 or 15 references in it that make it very clear we are a commission, we are not a board, and we are not advisory. We have certain responsibilities that are set forth in the statute. That's what we are here to do. We're like the Federal Trade Commission or we're like any other commission. We have responsibilities. That's not to say that we don't interact with the commissioner, in fact, but if you look at the Massachusetts, the state, the city's ordinance on this issue, it lays it all out. It talks about the commissioner being paid, that's Commissioner McCosh, and the rest of us are associate commissioners. It's right in the city laws. And so, you know, I just think our mission, I don't know that there's a more important mission that anyone is trying to fulfill in this city than what this commission is is designed to do. This is a solemn responsibility we have. And I believe, I don't know if the rest of you may or may not agree with me, that it's imperative on us, especially because of our mission, to do things right.
So Richard, I'm just gonna.
Please, let me finish. And do things as the law states. And the law is very clear. Now, the fact that Tom Menino, who I love and knew well, didn't want supervision over the commissioner, our job isn't to supervise Commissioner McCaution or staff. They have their responsibilities, but we have ours. But I think it behooves us to do things in accordance with the statute, in accordance with the instructions from the state, and in accordance with our own city bylaws.
Okay, so I am going to jump in now, Richard. I am going to jump in just to say that we are in discussions with the law department and with MOD. So we do need to update our charter. So we're going to be looking at changing some of the things that are in there. So some of it may be moot. We may not actually be under 8J anyway, because I know Boston is, has some special, not special, but different, like Cambridge doesn't fall under 8J. So I'm not 100% sure that we do fall under 8J. So we're going to clarify.
Commissioner, I hear you, but the Boston municipal laws lay out who we are. You're the commissioner, we're associate commissioners.
Right, so that's what we need to update. We have already talked about the law department about updating all the language.
So you have to change, go through the city council, but right now, until that happens, we're a commission, so we need to change the letter to say we're a commission. We're not an advisory board, we're not.
All right, so I just told you we're going to be updating that, but that's not going to happen tonight. So why don't we table this until the next meeting? Because there's no more information we have for you tonight.
If you want to table sending the letter to the governor, then fine.
So this is Andrea keeping track of Robert's Rules of Order. Wes has made a motion to approve the letter. If there's a second, we can move to a vote.
I thought the commissioner was saying we should put this off till next month.
No, we'll put the discussion off because we want to notice it publicly when you're launching into a big discussion about legal issues. And things like that. That will be put off till next month, new business.
This is Jerry. As I said earlier, I believe that the chair, under Robert's rules, I believe that the chair is not allowed to make a motion. I'm happy to make a motion, though, that we approve both. We approve the letter to Governor Healy as written and edited.
Thank you, Jerry. So you've made a motion. I want to see who would second it.
This is Carl, I second.
Okay, so Carl's seconding it. And who's gonna move to approve it?
This is Jerry again. Just to be clear, my motion is to approve and send out the letter as it currently states.
Okay, so, to how the letter is written right now, the motion to go ahead and send it to the governor, it is on the table and has been motioned. Will somebody second it?
This is Carl, I second, and I suggest you call it to vote.
Okay, so who's in favor, say aye.
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 Okay, and who's against, please say that you're against.
I am against.
Okay. So we have one against, and who's,
Abstaining.
thank you. So this motion has been passed. Okay, so the second thing, do we have time to talk about the letter for, for the Attorney General's,
I missed her name.
Andrea Campbell?
Campbell,
Yes.
thank you. Campbell, yes. Attorney
This
General.
is Jerry. I move that we approve the letter as written.
Okay. And who wants to second? Jerry?
I'm sorry, could you repeat which letter this is?
This is the letter to the Attorney General Campbell.
We need a second. Olivia has her hand raised.
Olivia seconded.
I
All in
second.
favor, please raise your
the
hand.
letter.
Aye.
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 Any opposed?
Yes. For the same reasons. I don't think we should do something that's contrary to our enabling statute or other laws.
I think Charlie, both for the last vote and this vote, I think he's trying to indicate something.
We should have had discussion.
And that is part of usual rules.
Oh, I apologize.
Why
I do
don't we
apologize.
let Charlie speak?
So let's discuss the letter.
I'm sorry, I missed the letter to Attorney General because I did receive and saw the redraft for the governor, but in the emails that I was also searching, was there a letter that I had missed? 'Cause that's what I was asking before we went into the vote. What should I be looking at before we vote
It was
on it?
part of the email that Andrea had distributed. There was a letter attached.
2 letters.
And I had revised the letter
Yep. One
to
second.
tailor it more for the Attorney General.
This is Andrea, just as a point of order. When we voted to write a letter to then Governor-elect Healy, we also voted to write a letter to Attorney General Campbell. We only had a draft letter for Governor-elect Healy in December, but we now have a draft for both, which were distributed last week. They are in very nearly word for word the same. One big difference that Wes put in was in the board's reference to the departments and offices that you're looking forward to working with, taking out the executive offices that the governor oversees and adding some of the divisions of the Attorney General's office.
Okay. Thank you. Thank you for that clarification on that. That's all I was raising my hand. So I guess technically, Andrea, I was abstained on the second vote. And I apologize to the rest of the board on me not seeing that.
We will
particular
know,
letter.
let the record show that Charlie Kim has abstained for the vote. Okay, thank you. I'm sorry, I am truly exhausted.
The next item on the agenda is the board bylaws. And as we have just discussed, I agree there is some type of confusion on whether we are an advisory board or a commission. And I'm going to open the floor, and be aware we have 5 minutes left. Jerry, I see your hand.
Yeah, Wes, thank you, and I appreciate, that this discussion has been lively and kind of unruly at times, but that's another reason we're here, right, to discuss things. But I just want to be clear, did we vote, did the motions to approve the letters, did those pass? Will the letters be going out?
Yes, by my record, the letter to Governor Healy had 9 in favor, 1 opposed, and to Attorney General Campbell, 8 in favor, 1 opposed, 1 abstention. So both letters passed.
Thank you. And I look forward to the discussion around the bylaws and changing any language that we need to regarding our roles and what we call ourselves. Let the record show, though, that as long as I've been on the commission, and this is my second term, and I believe I believe there are others that have been on longer, including Carl, that we've always considered ourselves advisory board members, and I don't believe that that's impacted our roles or our ability to do good work, on behalf of the city and behalf of people with disabilities in the city. So.
Thank you, Jerry. I see Elizabeth, your hand is raised.
Yes, thank you. I think it is important to clarify the language of the board as well as its implications for our role. If there are any that certainly in reality and function, it seems like it has functioned as an advisory board. I do think those were valid issues that Richard raised, but I think in the interest that while we're figuring out some of those specifics, particularly for those of us who don't have a legal background but realize it's not only semantic, but that we've also been criticized if they're for delays. I think as far as the importance of welcoming the governor and the attorney general, and weren't we also going to do the lieutenant governor? Did we previously agree on that as well? No, not the lieutenant. Okay. But then in any case, I think the timeliness of having our presence known, or our work, our interest was of a higher level importance for this particular time-sensitive. But I would not characterize the discussion as unruly. From my point of view, I think that those were valid points, and it also, other than the Roberts Rule of Order of just getting that straightened out, I think it's important that we bring it up again. But I felt it was important also to proceed in moving forward on these 2 particular letters. If our future discussion has bearing on the name of our entity and the functions of our loosely using advisory group, then I think further correspondence and discussion, or sponsorship or whatever the word is, should indicate that. Thanks.
Thank you, Elizabeth. I'd like to review the December board meeting and propose a special meeting for this discussion on bylaws, because it is a big deal. And I would ask Andrea if she could set a special date for us. We have 48 hours to notify the public of any special meetings that we plan to hold, and so we want to make sure that is not a concern to the general community. And also, if they have questions about the special meeting, they can ask us. I'm hoping that everyone will agree with this. Thank you so much. I want to respect everybody's time and truly move on to the next agenda item. We have the board elections for 2023. I know there's still some time to nominate individuals, and I believe that Commissioner McCosh has a list of nominations. Would you like to talk about that, Commissioner, or would you like to table that?
I don't know if anybody gave any thought to nominating themselves or someone else, but I was going to nominate the executive committee for the same roles again this year, because I think they did a great job. So that's my nomination. And if anyone else has nominations, feel free to speak up.
So this is the time if anybody has questions to speak up.
Could you tell us, those of us who are new, who those all are?
The commissioner's nominations are for the same people. I myself, as the chair, Desea as the vice chair, Paul as the secretary, and Carl as the treasurer. I know we don't have any money for this board, but the elections take place next month. I want to see if there's any final submissions.
Wes, I'd like to suggest that we leave it open so people can still think about it until next month.
Okay. That's good advice. I want to leave some time for new business and the proposed future advocacies. But looking at the time, would you like to table this for the next meeting, or would you like to stay for a few minutes?
I have a question. If we stay, I mean, does that impact the cable at all? And
well, that's a good question that I'm wondering about.
We're also obligated to do public comment.
right.
But we only have the interpreters, ASL interpreters, for a certain amount of time.
Right, so considering all that, I don't know if we have any time.
This is
Carl, I
Andrea.
suggest we table that for next meeting, given that we're still trying to figure out what our role is at large.
That sounds good.
I think Andrea has a comment.
And so, Carl, I think you have something important to say?
I do.
Wait a minute, wait. Olivia brought up a great point. We're obligated to do public comment. And Andrea is trying to chime in, so we can't have your comment yet, Carl.
No, I wasn't sure what he meant, but no, I'll do that after public comment.
Hi, Jerry. I just wanted to say cable can stay on for a few minutes. If our interpreters and CART can stay on with their schedule, we will certainly pay the additional time, of course. So ASL interpreters and CART, please let me know if you can stay on. All right, I'm going to take that as a yes since you're all still here. Okay, perfect. Then public input would be the last thing on the agenda.
So we're not doing new business? This is Jerry.
Okay, so,
I would like to open it up to public comment.
okay. So, we're gonna open it up for public comment. Okay. I'm really confused. Are we gonna go on with new business or public comment?
Wes, that is your discretion as chair.
Say that again?
That is your discretion, in your discretion as chair. We do have to open it for public comment before we can leave, but it's to you to decide if you want to skip new business in favor of public input.
Okay. I guess I'll go ahead and talk about the new business. I want to give things for you to think about for next month. Okay. For the purposes, the success of, I'm sorry, the success of passing December minutes. Sorry, the interpreter's having a difficult time here.
Yep.
Can you help?
We have new business here, so for the next month, I would really like to get public input on what we should be considering for next month in discussing new business. Does any members of the public have any comment that they would like to bring forward related to new business? Is there no public input?
This is Andrea. I don't see anything in the chat, nor do I see any members of the public with a raised hand.
Okay. I would like to propose that we close the meeting.
This is Carl. I make a motion to adjourn.
Whoa.
I'll second it.
I thought we were discussing opening
All in
up new
favor?
business.
Oh, this is a little bit.
I thought we were discussing new business. Whoa.
My understanding is we were going to hold that and table that to the next meeting, but allow for public comment on new business topic items, and then close the meeting.
I'm sorry,
I thought we
was
were going to discuss it, but definitely,
I was very confused by the way you worded that last section of the meeting, Wes. But I do appreciate the lively discussion we've had, and appreciate your role as chair trying to navigate all of that. So I'm fine with tabling new business, and anything that I have that can't wait, I'll email the commissioner and staff. So.
Yes, just as a point of order, I believe the public input is for the entirety of the meeting, that comes at the end, but they can address anything they want to, because they've been often, that's the chair's discretion, but often they've been asked to wait until that point. But I'll do the same as Jerry as far as new business.
This is Andrea. So again, we had a motion from Carl to adjourn and a second from Dick.
Do we take a vote?
yes. All in favor of closing the meeting?
Aye.
Adjourning?
Aye.
Okay. Thank you all again. I apologize. I am incredibly exhausted. Have a good evening. I send grace and thanks.
Thank you.
Thank you.